Students, I'm going to review the disease sheet for rheumatoid arthritis in this presentation. So let's start with the pathophysiology. Okay, so rheumatoid arthritis is an autoimmune disorder that usually attacks the small joints, which result in deformity. Now, I have talked before about how most of the connective tissue disorders or autoimmune disorders have basically a lot of the same signs and symptoms, but usually there's like defining characteristics of that one disorder. Okay, so for rheumatoid arthritis, it's going to be the deformities that happen in the joints. Now, if you look at this picture right here, you can see the fingers have what's called a swan neck deformity. And there's a little boutonniere's deformity on the thumb. Okay, so you would see that on both hands because rheumatoid arthritis is a symmetrical condition. In other words, what happens on one side of the body is going to happen on the other. Okay, now let's go over to recognizing cues, which is our signs and symptoms. You can remember the mnemonic EARS. So E stands for early morning stiffness. Now, one of the characteristics of rheumatoid arthritis is that when people wake up in the morning, it can take them 1 to 2 hours to get going, okay? Because they are so stiff. Their joints are going to be red and warm and inflamed, especially if they're having an exacerbation, because like all connective tissue or autoimmune disorders, they are going to go through life with periods of remission and exacerbation. Usually exacerbation, which is a flare-up, usually comes on by some kind of stress, okay? They'll have arthritis of the hands and sometimes the feet. People can get these kind of joint problems in their feet too, okay, with rheumatoid arthritis. A dry mouth. Anybody with a connective tissue disorder can suffer from dry mouth and dry eyes. It's a common problem. Rheumatoid nodules. So rheumatoid nodules can appear on their skin. And then symmetrical swelling of warm joints. I talked about that. They could also have a low-grade fever. One of the things you can teach your clients is in the early morning, when they have that early morning stiffness, to have a cup of tea or a cup of coffee and put their hands, if it's not too hot, of course, check the temperature, around their cup of coffee to try to warm up a little bit. Now, the complications of rheumatoid arthritis are going to be similar to lupus with immobility. You know, if their hands and feet are not functioning properly, they may become immobile. So that's something we try to prevent. They may have the pericarditis I talked about in lupus and the pleuritis. They could have Raynaud's. I talked about that before. And I talked about the dry mouth, which is xerostomia, okay? Risk factors, it could be genetic. Usually women have this disorder and it presents at ages 30 to 50 years. Now, it could have been developing over a number of years because a lot of the signs and symptoms of rheumatoid arthritis are the same signs and symptoms of aging. So they may not know right away, is what I'm trying to say. So the diagnostic studies involve a high white count. That makes sense, right? Because it's an inflammatory condition. They'll have a high C-reactive protein. Remember, that's a non-descriptive marker of inflammation in the body. So in other words, anybody with any type of inflammatory condition can have a high CRP. Elevated sedimation rate. That's also a sign or nondescript test, I should say, for inflammatory disorders. The ANA, which is an anti-nuclear antibody titer, and the ESR stands for erythrocyte sedimation rate. Rheumatoid factor is also an inflammatory marker, and it's nondescript, meaning just because your rheumatoid factor is elevated, it doesn't necessarily mean you have rheumatoid arthritis, but it will be elevated in people with rheumatoid arthritis, okay? They could do what's called an arthrocentesis, which is where they will take fluid out of the synovial fluid, okay, which is in your joints. They will take that and look at it, and it will show WBCs and rheumatoid factor. So the nursing care is what's really important. You want to encourage your patient to move. You never want your patient to move if it's painful. So ask them to exercise daily as tolerated. You got to keep those joints moving. You're going to collaborate with occupational therapy. They'll work with uh, their hands, and if they need help cooking or writing, anything like that. OTs are wonderful. Physical therapy and dietary. A rheumatologist, which is a type of medical doctor that deals with connective tissue or autoimmune disorders. Um, you want to facilitate the use of assistive devices. We like to keep people as independent as possible with the use of assistive devices, letting them do things on themselves. So the nurse has to be very patient, which can be hard at times because you're busy, I know, but it's really important that you let the patient do everything they can for themselves. You want to maintain a safe environment. So that means no clutter on the floor, good fitting shoes, all those things. Call bell within reach, side rails down, etc. You want to evaluate how the medication is working, because they are going to be on a medication regime. And remember, the goal is always to promote independence. So again, client teaching, you want to tell them to exercise daily as tolerated. They can't make up for lost exercise. Okay, so let me tell you what this means. So say I had rheumatoid arthritis. I wake up today, my joints don't feel good. I just don't feel good, so I don't exercise today. I don't do double the exercise tomorrow. Okay, I just pick up where I left off. Okay, you never want them to exercise past the point of pain. Like, they shouldn't feel pain in their joints while they're exercising. Um, if they can do, I don't know if you've ever had this treatment, it feels so good. Heated paraffin wax for their hands. It really could help their hands to get moving in the morning. If they need to do some walking or some type of exercise, they should take like a warm bath or warm shower before, to get the joints warmed up and ready to go. They need to take their temperature daily and report a temperature, because that could mean that they're about to have a flare up. And they need to engage in medication compliance. Okay. Now, they are going to be on DMARDs, which are disease modifying anti rheumatic drugs. Okay. You're going to learn about these in pharmacology, but I have acute mnemonic here if you want to use it. You won't need it for this upcoming test, because I've already mentioned what I needed to mention. And yeah, that's it. That's rheumatoid arthritis.